fam, Dr. Sam here. I wanted to make a quick video about COVID-19 or coronavirus disease 2019. There's a lot of misinformation, there's a lot of panic, a lot of scare surrounding this disease. And I think it's really important that we get on the same page as a single community. We ensure that we're staying informed, that the information that we are getting our hands on is credible. 2 days ago, the chair of the infectious disease department here in my hospital in Chicago gave a really good talk. It was super comprehensive on COVID-19, and I took some solid notes and I wanted to relay some points from that presentation. I apologize in advance if this video is longer than my other videos because there's a lot of ground to cover. But I really want to talk about COVID-19 in 4 different ways. First and foremost, I want to talk about coronavirus, what it is. I want to talk about how it goes about causing an infection, why the transmission rate is so rapid, what makes it so contagious. I'm going to talk a little bit about the interventions that we need to make as a community, why we need to adhere to those interventions, and why those interventions are so important. I firmly believe if we understand why we are asked to do the things that we do, we're more likely to be compliant and do it. And the last thing I want to talk about is some of the treatment modalities on the horizon. First and foremost, what is the coronavirus? Now, interestingly enough, the coronavirus is a virus that's been around since time immemorial. The first documented case of an infection by the coronavirus dates back to the 1960s. In fact, coronavirus, rhinovirus, adenovirus, all of these viruses are culprits of the common cold. Over the years, the coronavirus has undergone certain mutations which has caused significant sicknesses and illnesses in the past. For example, the SARS outbreak in 2002, severe acute respiratory syndrome, was caused by coronavirus, or a mutated version of the coronavirus. And then there's MERS, which is the Middle Eastern respiratory syndrome, which was in 2012, and that was also caused by the coronavirus. The next question is well, how does it go about causing an infection? Recent studies show that the coronavirus actually attaches to a certain receptor called the ACE2 receptor. And when the virus attaches to that ACE2 receptor, it then unloads its contents into the cell, causing an infection of the cell and causing the cell to basically make multiple copies of that virus. So ACE stands for angiotensin converting enzyme. The ACE2 receptors are expressed in the lungs, and that's why it causes this severe lung infection and often pneumonia. The ACE2 receptors are also expressed in the kidneys, in the blood vessels, and in the GI tract. And that's why a lot of the symptoms of COVID-19 are shortness of breath, fever, and cough, because the ACE2 receptors are expressed in the lungs. However, there are a number of cases that have presented with gastrointestinal symptoms like nausea, vomiting, and diarrhea, and that's because the ACE2 receptor is also expressed in the gastrointestinal tract. As far as vulnerable populations are concerned, individuals who suffer from diabetes and individuals who suffer from hypertension, they have an increased expression of the ACE2 receptor, as well as elderly populations have an increased expression of this receptor. And that's why those individuals who have diabetes, hypertension, and individuals who are elderly above the age of 60 are particularly vulnerable and particularly susceptible. The next question, why is the transmission rate so rapid? In fact, the doubling time of COVID-19, the novel coronavirus, is around 6 days, really 2 to 3 days, but maximum around 6 days, which means that if 50,000 people are infected, 6 days later, 100,000 people will be infected. Another 6 days later, 200,000 people will be infected. And that isn't to scare you, but to basically help you realize that this is something that's very serious. It is something that is rapidly transmitted, is very contagious. Part of the reason why it is so contagious is because recent studies show that it can exist in an aerosol form. So what that means is that is that when an individual coughs or sneezes or whatever, there are little droplets that are light enough to float in the air. And this virus can exist in that form, but only about 1 hour. The virus can also exist in a respiratory droplet form. In that form, it's a little bit heavier, so it falls. It falls on clothes, falls on the hands, falls on surfaces. And certain studies show that it can exist on those surfaces from 9 hours anywhere to 2 days. So we can't say, whether or not it's viable on that surface, but certainly it can live on those surfaces for a long period of time. And that's why it's really, really important to clean surfaces and really, really important to wash your hands frequently. Now, as far as should we wash our hands with soap and water or use sanitizer, for washing our hands with soap and water for at least 20 seconds, the trick we use is sing happy birthday. If we wash our hands for 20 seconds, it's a little bit better than alcohol. However, the wall of the virus is really fragile, so even using alcohol is effective. And the last reason as to why it is so contagious is because a lot of individuals will become infected and contagious even before they have symptoms, and a lot of individuals also will be completely asymptomatic and are still contagious. And so what that means is we have individuals who are walking around, they have absolutely no symptoms, and they are shedding the virus. And if we look at certain case studies, so in Taiwan and in Hong Kong, even though geographically speaking those places are in such close proximity to the epicenter of all of this in China, in those cities there have been less than 10 deaths and less than 200 cases. And the reason for that is those governments in those cities were very, very particular about hitting the ground running and starting the quarantine and self-isolation process right away. And that's why it's so important that we stay home. This brings me to this notion of flattening the curve. This idea of flattening the curve is that if individuals are going out and about and they're getting themselves sick or spreading the virus to vulnerable populations, and these vulnerable populations are ending up in the hospital, eventually we're going to run out of respirators and ventilators, right? These individuals who have severe enough infections, they need ventilator support, they need oxygen. And so if we flatten out the curve, aka we reduce the frequency of illnesses, we reduce the frequency of visits to the hospital, then we won't overburden the hospital communities and the hospital healthcare system, and we'll be able to take care of everyone. So that's this notion of flattening the curve, and that's why it's so important that even if you don't have symptoms, that you stay home. Absolutely. As far as the treatment modalities, there is a good amount of promise. More than likely, a vaccine won't be available for probably a long while, 6 to 12 months. But there are two medications in particular that are showing a great deal of promise. One is an antiviral medication, and the other is an anti-malarial medication. The anti-malarial medication in particular is showing a great deal of promise. French researchers used this anti-malarial medication called Plaquenil or hydrochloroquine in conjunction with an antibiotic, azithromycin, and were able to successfully treat individuals who were suffering from COVID-19. So as far as whether or not these medications and these interventions will get approval, that is kind of dependent on the FDA. Currently, Plaquenil is going through aggressive studies, and the antiviral medication is going through phase 3 trials. So on the horizon, we do have treatment modalities, but the most important takeaway from this is that it does cause severe respiratory illness and can lead to death. And so it's really important that even if you don't have symptoms, that you stay home. And if you're sick, you should particularly stay home. Now, of course, if you're significantly short of breath and you're running a fever, then come to the hospital if you feel as if you need the oxygen support and you need that intervention. But if the symptoms are mild enough, please stay home. And even if you don't have symptoms, stay home, quarantine yourself for the next 2 weeks so we can beat this thing. I hope that answers some of your questions. Make sure to wash your hands. Don't touch your face, your lips, your mouth. Use alcohol sanitizer. Stay home. Flatten the curve. If you have any questions whatsoever, please either email me, AskDrSamMD@gmail.com, or send me a private message. I hope this video was helpful to you. And before I go, what do you call a bear with no teeth? A gummy bear. Hey guys, what's up? Dr. Sam here. I just wanted to make one additional point to the video that I posted, and that is a lot of people are really up in arms and a lot of people are upset that there aren't enough testing kits, right? But the reality is that not everyone needs to get tested, and moreover, even if individuals were to get tested, how does that actually change the management? How does that actually change the intervention? If we just operate under the assumption that you are an asymptomatic carrier or you have the infection, or if you do have symptoms and you have the infection, the management doesn't change, right? Like we're still encouraging everyone to stay home, flatten the curve. And until and unless you get to a point where you are severely sick, you think that you may need the support of oxygenation, you may need the support of a ventilator, and so on and so forth, then at that point, of course, you're going to come to the hospital. But outside of that, you're going to stay home anyway, right? And the benefit of staying home is that not only will you not expose yourself, but you'll also, if you are a carrier, if you are infected, you won't expose others, especially the vulnerable patient populations. So there's really no point in getting so upset over the fact that there aren't enough testing kits available, because it's not really going to change the management. We're still encouraging everyone to stay home. We're still encouraging everyone to quote-unquote social distance and self-quarantine, at least for 2 weeks, because we know the disease process takes approximately 2 weeks. Again, if you have any questions, feel free to email me, AskDrSamMD@gmail.com, or slide into my DMs or comment or whatever have you. Stay safe out there. Don't forget to wash your hands, clean your hands with hand sanitizer, and keep your hands away from your face. Stay safe.